Most women normally become psychologically tortured when they realize that they have missed their menses, whether they are married or not married. But some of them normally they become very, very happy and they embrace this kind of not seeing their menses because they suspect that they might be pregnant. So therefore today I'm going to take you through how you can do pregnancy test at home with the following requirements that I'm going to list here. Of course, you can have clean gloves, and your urine samples. So I have two urine samples. One is from a pregnant mother and one is from an unpregnant woman. They have gained their consent to take their urine sample for this particular test that I'm going to show you. And I have two test kits that I'm going to show you at the end of this video how you are going to use this. Now, before even we think of doing this particular test, what are we looking for in this particular urine? What are we looking for? Normally, when you are pregnant or when you have conceived, the placenta normally produce what we call human chorionic gonadotrophin hormone, which averagely by 10 days can be detected in urine after conception. Majorly 2 weeks after getting pregnant, you can normally detect this in urine. And normally you use this strip to test this particular way so that you can know whether you are pregnant or not. Now, most ladies will opt to do this test because one thing they have experienced in their life is that they have missed their menses. They have what we call amenorrhea. They have missed their menses and they suspect that they are pregnant. So you should be able to know that when you missed your menses, it is not equivalent to being pregnant. There are several factors that can make you miss your menses. For example, or when you have changed environment, maybe you are in Nyanza and you've gone to Nairobi or Nairobi back to Nyanza, it can interfere with your menstrual cycle and probably sometimes you can miss. When you think that you missed, you will have what we call psychological stress. You might think that you are pregnant. This stress also is another way of making you to miss. Stress can come in different types and in different stages, and it can be stress on the positive sides. You are too happy, maybe you won jackpot, you will miss your menses. Or you are too sad, you don't have money, you will miss. Sometimes you might miss your menses. So psychological torture, psychological stress can make you miss your menses. Also, when you are on contraceptives, particularly when you meet your partner and you use this the so-called EPI, emergency contraceptives, it will sometimes one of its side effect is you can skip your menses, and that is very, very normal in the therapeutic level of using this particular drug. Also, when you are breastfeeding, you know the hormones that normally produced when you are breastfeeding, it normally suppresses the ovulation, and you might miss your menses. That is prolactin. So you might be very, very vigilant when you are breastfeeding. Sometimes you might miss your menses, and it is normal. It's called breastfeeding amenorrhea. That is missing your menses because you are breastfeeding. Also, when you are chronically ill, maybe you are suffering from diabetes, you're suffering from HIV, you're suffering from debilitating or chronic illness like cancers, you might miss your menses. All those people who have a condition called polycystic ovarian syndrome, it can lead to you to miss your menses. Generally, what we call hormonal imbalance, the imbalance between the progesterone, estrogen, follicular stimulating hormone, luteinizing hormone, even direct from the hypothalamus when there's a problem with the gonadotrophin releasing hormone, to sensitize all those hormones that I've mentioned, particularly gonadotropin releasing hormone sensitizing the pituitary gland anterior to produce those two hormones, follicular stimulating hormone and luteinizing hormone. If there's a derangement and interference with that particular axis, it can make you to lose your menses. Particular food, when you are not, particular diet, when you are dieting, extreme weight loss or obese, you can lose or you can miss your menses. So a lady should be knowing this particular issues, and even during strenuous exercises. You can miss your menses, particularly those ladies who normally like going to gym. It's normal. So you must confirm this by doing this particular test that we are putting today. Now, when you are approaching your menopause, it's likely you may miss your menses, or perimenopause, you can miss your menses. So knowing all those, you are able to know now that I've missed my menses because of this. So this particular test will help us to know whether you are pregnant or not. So we might have a test which is positive or a test which is negative. And of course, we should be realizing there are false positive results. False positive results. You do pregnancy test and you find you are pregnant. What are the conditions that can bring this particular false positive result? One, when you have a recent miscarriage, abortions. When you have abortion, a few weeks pregnancy test, if you use urine, this test will still be positive because those HCG, human chorionic gonadotrophin, is still in your system. And when you have gestational trophoblastic diseases like hydatidiform mole, if you do this particular test, you can get that you are pregnant. And I had talked about a condition called blighted ovum. Blighted ovum, of course, that is an embryonic pregnancy. Fertilization has taken place, but there is no embryo developing. So the gestational sac is visible, but there is no embryo inside there. I've talked about that video of blighted ovum. If you want to do that, if you want to watch that video, kindly, the video may appear somewhere up here. So watch that, an embryonic pregnancy or blighted ovum. So blighted ovum can make the pregnancy test to be positive. Also conditions like ectopic pregnancy. Ectopic pregnancy can also result into a pregnancy test being positive. We say that this is false positive because ectopic pregnancy is where implantation takes place outside the uterus. And we had talked about ectopic pregnancy in one of my videos. If you missed that, maybe it's appearing up here. You can click it and watch this particular ectopic pregnancy. So do not get worried. The only time you can get worried when you missed your menses is when you have met a man, when you had coitus before you missed your period. If you have not missed your period, then those conditions that can make you miss your period that I mentioned earlier can normally make you to miss your period. But number one thing is that for you to be pregnant, there must be spermatozoa that will meet the egg, and fertilization will take place in fallopian tube, and then implantation into the uterus about 6 days later after fertilization. So make sure that if you are too much worried because you have missed your period, this one should not worry you if you not met a man. But if you constantly miss your period, then there might be a problem. And I talked about this particular topic in causes of infertility in women. If you have not watched that video, sometimes it might appear up there of causes of infertility in women. There must be a problem, particularly if you are doing 3 months and you are not on any family planning methods. You have no psychological stress, you have not changed environment more frequently, you are not attending gyms, those issues that I've mentioned. Kindly visit gynecologist for more information, or you can even consult me via my WhatsApp number that I normally place in my about of my YouTube channel. So if you love what we have discussed and what we have said, before we go to actual testing of this pregnancy test kit, hit the notification bell, rate and subscribe, turn it on for very nice videos that I will post. Now let's go to the actual test, and we will be very, very happy if you follow this until the end of this video. Now before you actually test yourself, now you've missed your menses and you have met a man maybe some few weeks before you missed your menses, and you've gone to the shop, and this one normally range from 50 shillings 20 shillings. That's past 100, but Kenyan shillings. But if you go to the hospital, we'll do test. We will pay around 300, or private hospital they will do around 500 shillings with the simple test. Now, this particular test I'm going to show you in the screen. First of all, you must make sure that you follow the instruction that is in this particular kit. Each and every company has its instruction, and there's instruction that is in this particular one that we are going to show into the screen. And when you have a sample, when you have your urine sample like this, then there's an instruction on the back side. The anterior side is 1-step urine pregnancy test strip. So it means that you cannot use this twice, and you should be able to look at the back side, look at the lot number. The important thing I want you to check here is expiry date, because if you use an expired test kit, after you've cleared with the testing, make sure the desiccant, this is called the silica gel sachet, make sure you discard them for children not to eat. In fact, it's labeled do not eat because it's the one preserving the test kits inside here, and they are quite poisonous, so you make sure that you discard them out of children's reach. So if you like this channel, and if you love the video that we've just demonstrated how you can do pregnancy test, if you love this video on how you can do pregnancy test at home, kindly click this notification bell, rate and subscribe, turn it on, and always comment, like this video, and see you in the next video. Muchas gracias.